So I am a college professor. I say this because it is my dream job. From the first day I started college, I knew I never wanted to leave university, and somehow I've managed to do that. So now I get to sit in my office and think about the world and how I can make a difference. Most of the time that I have at work is spent coming up with ways to reduce the harm associated with the risk behaviors that we engage in, specifically the ingestion of psychoactive substances, which have been a part of who we are as a people for centuries and will likely be for coming generations. Harm reduction can take a lot of different forms. It can be education, it can be condoms in schools, it can be methadone treatment, it can be the provision of clean needles, it can be heroin prescription. The goal of harm reduction at its most basic is to keep people alive and to avoid situations like this, and to keep people as healthy as possible. It's not about personal accountability. It's not contingent on behavior change. It is simply meant to keep people alive and healthy no matter what. So we come up with innovative ways to do that. This is most important today, perhaps. In the US, in 2015, life expectancy in this country dropped for the first time since 1993. In 93, that was because of AIDS. Today, it's because of opioids, and more specifically, heroin, which has become more and more popular over the last 10 years. And as if heroin wasn't deadly enough, more than half of the heroin supply in the US is adulterated or entirely replaced by fentanyl, which is a synthetic opioid 50 to 100 times stronger than heroin. And people are encountering this accidentally and dying by the thousands. So what do we do? How do we keep these folks alive? I can tell you, having looked at the research, the data do not support what we've been doing. It's not working. All of our indicators are going in the wrong direction. Addiction is up, mortality is up. We have to change the way we think about this. One thing that we need to realize is that where you live matters. The neighborhood on your left has a lower life expectancy than the neighborhood on your right. Social determinants affect our life course and the trajectory of all of us. And we need to realize that when we're thinking about addiction, which is a disease that affects or creates a hidden population among us. So folks who are dealing with addiction are hidden both mentally and often physically, and that environment is unhealthy. So what we need to do is we need to create opportunity and space for us all to convene, right? To build trust. Active drug users do not trust us. And if we're honest, we don't trust them. We have to build that trust and get to know each other, okay? And one way we can do that, well, the best way in my opinion, is by providing a service that is essential to this population. If we build it, they will come. Active drug users, injection drug users need clean needles. If we offer them, they will come. And in that opportunity, that gives us the chance to interact with them, provide a myriad of services, and just smile and interact. Yes, we can provide clean needles in this program. 80% of the folks in this country that are hepatitis C positive are injection drug users. So this is an effective strategy for preventing the spread of that disease. But while we have them, we can give them a chance to survive if they do come in contact with one of these deadly substances. If you come to the needle exchange, I can give you naloxone, and if we're doing drugs together and I overdose, you can hit me with naloxone and I survive. That's harm reduction. And in my opinion, there's no argument against that. But we're not just providing the status quo when it comes to needle exchanges. Folks who have access to a needle exchange are 5 times more likely to go into treatment than folks who don't. We actually see lowered drug use among that population. But for me, it's more about the human contact. Addiction is an experience of guilt and shame and self-blame. I've heard folks say that they've gone a month without being smiled at. And think about how that feels. And we can change that just by bringing the community together. There are some folks doing this work in Asheville. The Steady Collective, they have 3 locations, one downtown, 2 I think on Haywood Road. WinCap is on Fairview Road. They've both been doing this for a while. The Steady Collective recently has gotten some blowback from the city about their location in West Asheville. The city responded to some residents' concerns about the environment and the clientele that were being drawn to the location around their neighborhood. And I'm not here to tell you that those concerns aren't valid, because they are. These concerns are real. What I'm saying is that this is an essential service for our community, and we need to figure out how to do it right. We need to continue having discussions and figure this out. We can put people on the moon, we can figure this out, okay? Beyond that, we live in Asheville. We don't sit on our hands and not have our voices heard. We get up, we advocate for us and those who can't. So I say we do that. We keep having this conversation. PechaKucha is chit-chat, I think, in Japanese, right? So I'm here to stimulate that conversation, because harm reduction is an act of love, people. These are some friends of mine who run needle exchanges in Atlanta, and the joy, you see this joy on their faces every day. So I say we keep having these discussions, we talk to each other, and we learn about this effort. Thank you.